like this, or if they're wide open like that. If they're blocked enough that we think it's causing trouble, they will open them up with a little balloon, a tiny little balloon that goes inside your artery and expands. And then they'll leave a little metal stent in there. And if that's what's needed, then you will be on some blood thinner, aspirin, and a medicine called Plavix, probably. There's some options for a year, and then you'll keep taking the aspirin forever. If there's no blockage, if this is all just strain from very high blood pressure over the years, then you will not get a stent. You'll just go home and they'll try to control your blood pressure better, and we'll work on that.
Okay, this tube that you say stay in my artery, it's going to stay there forever.
If you need a stent, they will put a little metal thing about this long and about as thin as the inside of a pen. Like, you know, the inside part, if I took this pen apart, you know, the inside part there, it's like that or even thinner. It looks like a really tiny hair curler, like this thick and maybe this long at the most. And yes, that stays in there forever. It goes inside your artery in here. They blow up the balloon and it squishes into the inside of the artery. And over the next few months, the endothelium, sort of the skin on the inside of the artery, grows over it so that there's no metal exposed to your blood. And yeah, it stays there forever.
And just to keep it open.
Right. That works much better than just using the balloon, because when you use just the balloon and no stent, we still do that sometimes if the area is too small or there's some other issues, but almost always we put a stent, because when you blow up a balloon in the artery, these walls of the artery get a little damaged, and they're more likely to close down.
Crush the balloon.
No, they won't crush the balloon, but over the next few months or years, they collect plaque again. But if you put the stent in, it holds it open, and it keeps it, your own inside of your artery grows over it, and it can still close up again, but it's much less likely. You have a much better chance of it staying like that for a long time. That's if you need that. And if you don't, then it's really just a matter of blood pressure control and weight and some other things like that. But this is something we have to do. We have to see if this is fixable. Fixing it's the only thing that will help you. And if it's not fixable with this, then we'll move on to something else. So that's where we stand.
So soon, as in the next 2 weeks soon?
Oh yeah, if they don't call you the next 2 days or so, or if they don't give you an appointment for more than 2 weeks, just call us back and we'll put you in one of the Brooklyn hospitals. It's a bit of a drive, but we'll get it done quicker. We have a little more pull down here, but yeah, they should get you in within a week or so. Once they call you, you should be able to figure out within a week. They have enough people to do this that they should take care of it pretty easily. They're a big hospital. If there is some problem, if they say, oh, it'll be a month and a half.
You can't wait that long. I don't want to wait that long.
Call me back at that point, and we'll talk about what to do. We'll get you in here.
I appreciate that. This is my dad, so when you look at him, I'm like, I'm his only child. So when you talk to him, I'm here. So that's why I want to make sure everything is good. I know you probably not, used to.
I sent my own father for this kind of procedure.
Okay.
I know what it feels like.
Well, right. Well, I'm glad that you do, and you can understand after having what happened.
Your shirts and jacket, I'm going to goes up and down and up and down. That's a terrible strain on your heart muscles. They flex and they relax and they get really stiff, and they may never recover after months of that kind of work. You have to take the same thing every day.
That's what she said.
If it's not working out, we'll give you more. We'll give you less. We'll give you a different medicine. There are 200 blood pressure medicines. There's probably more.
Yeah.
So we'll figure it out. But you have to take the same thing every day. I don't know what to change if you vary what you take. I don't know how it's doing. Maybe on one day it's good and one day it's bad. You have to take the same thing every single day.
Okay.
Do you have a doctor close to home? A general doctor that you have? A primary care or anything like that?
Only primary care I got
Good.
is in Up County.
How often you go there?
Maybe once, whenever he wants to see me, but that's,
Well, look, you can't come down here for a blood pressure check all the time. It's just too far. You have to get into your regular doctor, and I'll coordinate with your regular doctor. I'll talk with him, but we need to just know how you're doing here a little more frequently,
Well, he has a visiting nurse, and she lives right in town in Mount Vernon. She's an RN. She's fully qualified. She said the same thing that you said. That's the growth.
That's the growth. When did you, what is that?
Oh, Lord.
Surgery you're here for.
No. See, that's why if you let me explain, he's got a lot going on. There's the growth.
All right, so it's 180 over 110. That's not very good.
Well, that's what she said Saturday. She said it's bad. The thing about the medications was he felt better taking the 3 times a day because it didn't give him the headache. It's the
That's
same
fine.
medication.
So it's nitroglycerin of some sort. It's a nitrate.
Yeah,
It's the same.
it's just 3 times a day. It seems to affect him differently than your 1 time a day. But she told him either or you have to be taking it consistently. She said if you build a tolerance, then you might not have the headaches, but you have to take it long enough to build the tolerance.
Usually that happens, but if you go on and off,
That can cause it too. And she vehemently said that on Saturday. She checked all of his medications, and we're going to put together a pill box this week before Sunday so that he can know everything he needs to take. And she said you cannot take it as you reiterate it as you feel. It has to be consistent.
Now, are you taking an aspirin every day yet? We talked about that. Good. What we're going to do today is we're going to raise your water pill, your hydrochlorothiazide, from 25 milligrams daily to 50 milligrams daily. More water pill. It's a very effective way to lower blood pressure. You have to drink plenty of water. We're not trying to dehydrate you. We're not wringing you out like a sponge here. It's just, the way it helps your kidneys process, it'll lower your blood pressure. So drink plenty of water, and what I want you to do is I'll give you a prescription for 50 milligram tablets. Take 2 a day until you run out, and then you fill the new prescription and take 1 a day of the 50s. You understand? You'll take 25 twice a day. You can take them at the same time. It doesn't matter. And once you run out, if you've tolerated, if you're okay with it, then you go fill the prescription I give you for 50 milligrams of hydrochlorothiazide, the water pill. That's usually pretty darn effective at lowering blood pressure. I don't expect it to be perfect, but it should come down significantly.
Which is what we need. 180 is terrible.
Yeah, that's too high.
Which should be normal for him since I'm here.
Well, he's
140
Hold on a
or
second.
something.
you're about 55, 56?
My father?
Yeah.
He'll be 70 next year.
70, believe?
That's next year. We talk about this year.
I just said he'll be 70 next year. It's the truth. You need to just get used to it. You will be 70 next year.
Or 60.
Yeah, he's 69. He had a birthday on April 2nd, 4249.
Okay, I see. Someone gave it there.
Yeah, my father's actually getting up there.
All right, so for you, we permit a blood pressure of about 130 over 90, 135 over 90.
Okay.
Lower would be a little better, but we're a little more permissive as you get older. Even
Okay.
140 is not the end of the world. Now, the other thing you would need is you need a sleep study. Because you probably have sleep apnea with all this wood. Sleep apnea is when you sleep and your throat is closed and you breathe against a closed throat, and it makes it hard to control your blood pressure because that pressure transmits down to your heart and raises your blood pressure. I'd like you to call your primary doctor about the sleep study. They'll set you up somewhere close to home because, again, all the people I know are down here. So why don't you give them a call and have them organize that? That would be easier than me managing it up where you live. I don't think I can manage it.
Can you write a recommendation for that so I could give to Dr. Canal? Because I could easily give you his information. Because his name is Dr. Canal, Khanal.
To give them a call and tell them you need a sleep study. They will know someone. They will surely know someone close to home that will get your sleep study. If you do have sleep apnea, you will get a CPAP machine, a little machine mask that blows air down your throat while you sleep, and that will take a lot of strain off your heart as well and will lower your blood pressure. If this is one of the problems, it's very hard to beat with just pills, so you'll need this machine to help you sleep. Alright, so we'll set you up for this cardiac catheterization. We will call them today. They'll be in touch with you tomorrow or Friday, and they'll get you set up for the catheterization, the angiogram, and angioplasty at Montefiore. After that is done, you're going to have to come back. Alright. I would like to keep taking care of you, and I certainly will as long as you want to come down here. But if you have a blockage in your artery and real heart disease, you might be better served finding a cardiologist closer to home. We will see you as long as you want to come here. I will help you as much as you want to be here. I like seeing you, and I like seeing patients. But you might be better off finding someone close to home, because if you do need a stent, you're going to have to go in somewhat frequently for the first year or so, and it's a hike down here. So
Yes, it is.
We were going to say that. I was going to ask you that, but after
Yeah.
sitting with you and finally meeting you, look, I guess you're okay.
Even so, okay or not, you live far away.
And I think that's stressful for
Right.
him.
So we will help you through whatever you need, and we will always take care of you whenever you want. But you're probably better off finding someone that Dr. Kanal knows close to home. You're going to have to see someone a bunch of times. You have to see someone after the stent. You have to see someone a couple of days after that for a site check.
Okay.
And you can come here, of course, but it's a pain. You ought to find someone close to home. In fact, you could potentially even get cared by the people at Montefiore who do the procedure. You could ask them about establishing care for your heart up there.
Okay.
They certainly take whatever insurance you have.
Do you know someone there?
Not anymore.
Not anymore.
There's a lot of really good people.
Okay.
The whole program is good, but
Okay.
the people I know
Have gone.
A lot of the professors in New York move from place to place a lot, so the catheterization people I know there are not there. But you should.
Maybe we should come see you right
Well, you could-
afterwards and
well,
then
you
go
can
from there.
You can certainly do that. So what I want you to do is when you get scheduled, call me and tell me when it's scheduled, and we'll
Okay.
set you up for 2 or 3 days later to come and get that check. And after that, if you find someone up in the Bronx or up where you live, I will send all the records. I'll coordinate with them, and that's completely fine. For every person who goes away, I get someone else coming back the other way, so don't worry about it. But I think that if you have no stent, no need for a stent, not as much of a problem. But if you do have an old heart attack and blockages and everything, you're going to have to see a cardiologist 3, 4, 5 times a year. You're probably better off being closer, especially because if you have an emergency, then
Right.
they'll go to the hospital that they'll take you to. I don't go up there.
Right.
I can talk with people on the phone and help, and that's fine. And
Okay.
that's not a problem. But if you really have issues, you probably should find someone closer to home. I'm not kicking you out. Come as long as you want. As long as you want to make the drive, we're glad to have you.
Mhm.
But I think that let's see what we get as our results. And if it is that there's some heart disease there, you should find someone closer to home. Just better for you.
So that's what they would call heart disease.
Yes, you have heart disease. But there's a few different kinds of heart disease. Your heart is weak. It's pretty weak. It's not disastrously weak. You breathe okay. You don't have pain all the time. But if we let it go like this for too long, another year or two, you will have a lot of trouble. You never stay like this and you're okay forever. It gets bad eventually. So we have to work on fixing this one way or another. And if we can fix it with a stent, that's great. And if we can't, then it's just blood pressure control, and that's weight and sleep study, all these other things that we have to do. So that's what we'll do. I'm going to give you a prescription for 50 milligrams hydrochlorothiazide. You understand what I'm saying? Take
water pill.
Take 2 of them until you run out, and then
Right.
switch over to one of the bigger pill.
Okay.
Because it's 50 milligrams, so why waste what you have?
Right.
If you can handle that, just do it like that.
Okay. So, Daddy, you understand like what he's saying? Like, Vinny had this. He had to have a stent put in his heart. He was around your age. The funny thing is, he was about 68 when he had it. But then again, you know, Vinny has a little bit of weight on him.
Really had a whole lot of
Well, you say that as if you're not almost 250 pounds yourself. So it's like kind of the same thing.
All right. You can come on out. Give